we're going to talk about the latest on health and healing. Now, this impacts every person on the planet. How to slow down the aging of the brain. We'll give you the latest on that. We'll also show you about a simple, natural Middle Eastern sugar, natural sugar. If you've ever been in the Middle East, they use it in so many dishes, and it fights bacterial infection. We're talking about killing the infections. Also, something that is 1,000 years old that was found in the British Library, an old healing text. They actually tested it, and it kills the most powerful bacteria in the world. Yeah, the MRSA. How about that? Something simple, something we could all do. So I'll share that with you. I'll also share about eating fruits and vegetables with high pesticide levels, which is not a good thing to do, and a lot more on health and healing. Then I'm going, from our public health segment, I'm going to talk about our trust completely in doctors and medicine, where emergency medicine is unique and exemplary, and I commend it. It saves lives. But there are other countries in the world where if you had to have an operation, you'd be much better off have a much cheaper procedure and better procedure, less likely of dying or having infection than the United States. I'm only going to use one example, however, a diabetes drug. Now we find out it causes cancer. And we also know the big pharma was found guilty and fined for destroying the evidence. So what does it say about the United States or any place in the world where they manufacture drugs, make hundreds of millions and billions of dollars of profit, know the whole time that they're manufacturing a deadly drug, hide the information, and then when they're caught, no one is held personally accountable? Isn't it time that we changed the corporate charter laws in the United States to hold all corporate executives who are aware of information or should have been criminally liable for this type of malfeasance, for manslaughter, so they personally are held accountable, and their corporations cannot use their money, corporate money, to defend them? Do you think we would then have bad products, dangerous products, toxic products on the market? We would have the cleanest, healthiest, safest products in the world instantly. So isn't it time we did something? We'll talk about that. I'm going to do an extended piece today with Dr. Lucia Tomlevich. She is one of the greatest scientists in the world on the subject of vaccines. I'm going to present on an ongoing basis information showing you the truth of the safety and efficacy of vaccines. They don't exist. But I'm not going to present this information today. She is standing in front of a group of scientists from around the world making a presentation. What you cannot see is beside her is a screen. Every single statement she makes is coming from a peer-reviewed journal. She's only quoting independent science on the dangers of just one vaccine, Gardasil. She was asked to come to speak before the government of Japan, and because of that, they banned Gardasil. Why is it that governments are bringing her in to testify? Her documents, her peer-reviewed journals, her meticulous scholarship is respected. You won't hear a word about her in the American media. Mother Jones, The Nation magazine, the corporate left, and they're all suck-up corporate lefts. Why can't they ever interview her and look at her information instead of taking the corporate talking points and mouthing them as if you do not vaccinate, you're a danger to society, you're irresponsible? Well, unfortunately, they're not doing anything what I would call objective journalism. They've become nothing more than policy wonk hacks. Shame on them, because they've all had noble times with great articles and led the way, and now when they get into that comfortable position, at least those who are in the policy-making division, not all, you see how they become the corporate elite. We all want to shield our brains from aging because we have the largest aging population in American history right now. How many of us are there? Well, if you're over 40, your brain is substantially aged. You start aging at 27. Official aging. I'm talking about where we're going into old age at 27. Hard to believe? You got to understand the biochemistry and the neurological factors. So after the age of 40, we now have over 120 million of the population who are going into advanced age. That means you're going to see more dementia, Alzheimer's, Parkinson's than ever before in American history. We do not have a system in place to either prevent it, except those who have been aware and are making choices. So we're going to collapse the existing healthcare system. Here's what you can do. We'll start with little things. Green leafy vegetables, salads, healthy salads. This is from the Rush University Medical Center. Quote, a single serving of leafy green vegetables each day may help dementia be kept away. Researchers evaluated the eating habits of mental ability of more than 950 adults for 5 years. Those who consume 1 or 2 servings of foods such as spinach, kale, mustard greens, and collard greens daily experience slower mental deterioration than those who ate no leafy greens at all. The brain benefits associated with dark green leafy vegetables are crucial nutrients, vitamin K, for example. The researchers, quote, observed a protective benefit from just 1 serving per day of green vegetables, end quote. So that's important. Now, we know why, because of the phytonutrients. And the more mixed the vegetable variety, the better it is. They didn't mention the cruciferous except for kale, but we would mention broccoli and asparagus and cauliflower and dandelion greens and watercress and arugula. Those are also good. We would mention that having 5 servings of vegetable a day is the minimum I would require. Minimum. And upwards of 11. Hard to imagine? Not if you're juicing. If you're juicing a day, let's say 3 glasses of juice a day, you're getting 11 servings of vegetables. And then if you take your compounding powders, you're getting much higher, and that's why we've seen such remarkable improvement in people who concentrate on getting rid of the pro-inflammatory items, because the average American doesn't realize when you sit down to a meal, and if the meal is based upon your preference of taste and mouthfeel and how you feel eating it, the things that are healthy for you, you're going to exclude. For example, when you're going in to have a big hamburger or cheeseburger or steak, you're focused upon the meat and the sandwich. You're not focused upon fruits, vegetables, herbs, nuts, seeds, legumes, tubers, juices. None of that's important. So it doesn't matter, that little tiny garnish doesn't matter. And the lettuce they use in these fast food restaurants is garbage lettuce, and it's loaded with pesticides. So that's good news to protect your brain. So just imagine juicing and starting to have larger salads, and even having 1 salad a day that's nothing but sprout salad. I just had this last night. I took the most powerful healing sprouts known thus far, broccoli sprouts, a whole bowl. And then I added in mustard sprouts, radish sprouts, daikon sprouts, and sunflower sprouts. Made a homemade dressing, and with some coconut and olive oil, mixed with seasons and like tarragon, and a nice blend for salad dressing. Over salad is tarragon and anise seed, and you blend those together, and you put that into your olive oil, and if you want to sweeten it a little bit, you can put some little manuka honey in it. It's delicious. But just that digests quickly. It is powerful beyond belief as far as healing and preventing cancer, clearing the blood. It is a great detoxifier, and it has no calories in it. So you're not heavy in the evening, and you still get all your energy. So let's do far more salads and juices. Now, at Cardiff University, they found something that was interesting. Dates. More specifically, when you crush a date and you squeeze a date, a thick, sweet liquid comes out. And I've made date reductions a gazillion times. They're delicious. And when you make this reduction, you can make 2 or 3 ounces of it. It'll keep forever in the fridge. And then you can add that in with all your other reductions. You could have 30 different reductions in the fridge. And you spritz it a little bit onto something you're cooking, and it just pops the taste. Well, the date sugar, date syrup is what it is. It's unprocessed. It's natural. It's healthy. Now new research shows it kills a lot of bacteria, including the really bad Staphylococcus aureus and E. coli. This is going to be presented at the Society of General Microbiology's annual conference in Birmingham. And it showed that, quote, date syrup is able to inhibit the growth of bacteria faster than Manuka honey, which has previously been shown to have antibacterial properties and is increasingly used in dressings to improve wound repair. Dr. Taleb at the Cardiff Metropolitan University, who undertook the work, identified the date syrup contains a number of phenolic compounds that form naturally in the date fruit as it matures. Now, these compounds have previously been shown to have antibacterial activity. So the syrup is just a concentration of those phenolic compounds, plus it tastes good. But who knew until now that if you have an ulcer, you have a cut, you have an abrasion, you have something that's not healing, make a poultice of the date syrup. And you can buy this in every health food store, the organic date syrup. Now, what I would do, I would mix the date syrup with the Manuka honey as a dressing and put that on. Because now they show it'll kill Staphylococcus aureus, E. coli, Enterococcus, Pseudomonas. Wow, it just inhibits their growth right across the board. We could be saving lots of people's body parts, especially those with gangrene who get cut, don't know it, they don't feel it, they have neuropathy, and they get an infection, lose a foot. Now we have something that can help those individuals. So that's very good. Also, a good study shows that red grapes, this is from the University of Southern California School of Medicine, red grapes could help ease depression and what they're made from, or what they're made into. Now, as people know, I'm a big believer that grapes are one of nature's most perfect foods. If you can buy organic grapes, that's your preference. That would be number one. If you can't, then get a veggie wash or make your own. You can make with apple cider vinegar and hydrogen peroxide, and you agitate the grapes in the water, then rinse them all thoroughly, and you'll rinse 98%, 99% of the pesticide residue off. Then it's okay to eat. But ideally, the organic would be preferable. And what have they found? Now, eating the grapes, drinking the grape juice, the grape concentrate, or most powerful, the grape powder, what you're getting is you're getting some nutrients. Quote from the University of Southern California School of Medicine. Scientists have recently discovered a link between inflammation and depression, which affects approximately 148 million people in the United States. A new study finds that resveratrol, a natural anti-inflammatory agent found in the skin of red grapes, can prevent inflammation as well as depression-related behaviors in this laboratory experiment. Quote, our research is very relevant to today's society because it investigates potential treatments for people with an increased susceptibility to depression and related disorders that arise due to social stress. End quote. So, how about that for depression? And those who have non-Hodgkin's lymphoma, according to the Wilmot Cancer Institute, get your vitamin D. This was published in the journal Clinical Oncology. Why? Because they found that those that have the least amount of vitamin D are potentially at risk of that type of cancer. And an apple a day won't keep the doctor away by itself, but it may be the pharmacist. University of Michigan School of Nursing, quote, according to an article published in the Journal of the American Medical Association, Journal of Medicine, the apple has come to symbolize healthy and health habits, But can apple consumption be associated with reduced health care use because patients who eat them might visit doctors less? According to the University School of Nursing staff that did the research on this, the authors compared daily apple eaters, those who consume one small apple per day, with non-apple eaters. There were 8,399 survey participants who were involved in this, and what they found was apple eaters had higher educational attainment, were more likely to be from a racial or ethnic minority, were less likely to smoke. The authors measured, quote, keeping the doctor away as no more than one self-reported visit to a physician during the past year. So, when you eat apples, the idea of this study is showing that you seem to have a greater concern for your overall health, and that means you're likely to make other healthy selections as well. But if you don't eat any apples, then just like the people who didn't eat any salads, you're not going to be as healthy. Exercising critically ill patients may help speed recovery. Okay, the intensive care unit is the last frontier for physical therapy. It's hard to exercise patients hooked to ventilators. Now, some hospitals do manage to help critically ill patients stand or walk, even if they're tethered to life support. Now research has said that they better get on the ball and get these people into mobility therapies. So, no matter what the condition, you got to use their muscles or they waste away. And so get them up and get them moving, even if you have to help them and do whatever you have to do. Don't let people lay in bed. And finally, can kimchi alter the gut microbiota and influence metabolism? This is from the Dongguk University and Seoul National University in Seoul, Korea. Quote, consuming fermented kimchi, K-M-C-H-I, a source of lactobacilli, may alter the composition of bacterial populations in the gut and affect metabolic pathways of obese women. That's good. This was published in Molecular Nutrition and Food Research. What it means is that the bacteria in the kimchi is good for your body. Developing a taste for this is a different matter. However, it is good for you. And if I had no other fermented food or no other source of bacteria, good bacteria, probiotics, I would use it.